And when it came to the Proudly Cincinnati campaign, our idea was simple. We wanted to place UC on the world stage, but more importantly, we wanted to provide the impetus necessary to lead the next generation of advancements and innovations.
We created this Cincinnati Clinical Research Group in surgery, and basically what it is that it is a research enterprise, a research group, a laboratory that focuses on clinical research. In the short year that we've had, we've already put together numerous projects that are going to have some interesting clinical impact. African Americans, Hispanics, and Caucasians who undergo liver transplant. And looking at what do they look like when they get their transplant, where are they going, and what happens after. And what we found is that African Americans do significantly worse than Caucasians after transplant. What this kind of tells us is that there's something there. Now what we need to do is hone down on it, hone down on these community level effects of where are they living, how much resources do they have, who are they seeing, and try to figure out why we're seeing some of the things we're seeing. None of this would have been possible without the support of Maureen Heekin, who has supported the liver transplant program in the research side of things for many years. Her overall goal is to improve the care of patients and try to break down barriers and challenges in liver transplantation.
If one looks just within the United States and colleges and medical schools, you don't have to go far to understand what philanthropy actually means. I'm an endowed chair, which means that someone understood the importance of supporting leadership, ability to recruit people from other institutions, in my case Duke University, to be at the University of Cincinnati to further some of its goals and missions. And what separates UC and other institutions is their commitment to research is very much about how it translates to patients, to communities, to healthcare. Sometimes it's hard to know early on how and when that translation is going to occur. But UC, as an institution, and the College of Medicine is committed to what we call translational research, and that is bed to bench side, and that last critical piece is the community.
Unfortunately, my 24-year-old son developed a brain tumor that Dr. Tu diagnosed, which led to a rather quick surgery. He spent about 8 hours under a magnifying glass removing a 2 golf ball-sized tumor from my son's brain, and my son should probably be dead, but he should at least be blind, as that was sitting on his optic nerve. But through the skill of Dr. Tu and the team, the outcome was wonderful. He's a normal, healthy young adult. So yeah, in one sense it takes forever, but through constant research and effort, a lot of improvements have been made throughout the years, and it's not decades and decades to make improvements. Improvements are going on constantly. And when you get in these life and death situations, even small improvements can make a big difference in outcomes.
I was diagnosed in 1989, which was before any of the therapies for MS came down the pike, because of all the research that was taking place throughout the country and the world. What I really loved about UC and why the funds from my play, Above the 37th Parallel, went towards research here at UC was because I was so impressed with not only the education that occurs here, but the patient care that takes place in conjunction with the research. It was the first place in decades of having this disease that I found people who really spent time with me and listened to my concerns with the disease as it progressed. And so that became a reason to give back to UC. I think that people in this community need to know what's going on here at UC, because sometimes the doctors, the neurologists, the researchers are so busy. One of the things that one of the researchers said to me, the play itself gave him a chance to see past the cells. He said, he was so focused on his research that he never thought about how does this particular disease actually affect people every day. And with the play Above the 37th Parallel, he got to see the real effect on human beings.